following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, prescription drug abuse. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. West Virginia has a drug problem, and it's not crack or heroin or even alcohol that's causing the most trouble. It's prescription drugs, primarily opioids, narcotics used for pain. In fact, according to the Centers for Disease Control, West Virginia has the second highest prescription drug death rate in the country. How can we stop this problem? What are the signs that you or someone you care about are addicted? Where can you go for help? We'll get answers to these questions and more tonight from our two guests, Dr. Raleigh Sullivan, Director of Addiction Services at WVU Healthcare's Chestnut Ridge Center, and Dr. James Berry, who's also an addiction expert for WVU. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Raleigh, many experts say that the problem is an epidemic in our state.
Well, John, it has been an epidemic now for the past at least 10 years. It's interesting, the CDC, Center for Disease Control, just came out with this new data that says West Virginia is second in the nation. It used to be we led the nation. I'm not sure coming in second in this is all that great. West Virginia has had a problem primarily with prescription opioids, which are the powerful pain pills, for at least the past 10 years. And, that's a direct result of some of the things and some of the changes that occurred 15 years ago in the mid-1990s when pain pills became much more available. There are a lot of specific reasons, and maybe we'll get into it, about why West Virginia has had such a devastating problem. I'm sure most of the audience out there knows somebody who's on pain pills, or maybe themselves are on pain pills, or a family member, but it's been a huge, huge issue, huge problem for this state.
Well, maybe we'll be able to help some of those folks out tonight. And Jim, is it your experience that the misuse starts with proper prescription drugs and then moving out onto a problem?
Yeah, misuse is rather broad category, and that would mean using the prescription in any way that is not intended by the physician or instructed by the physician. And so if a prescription says, for example, take one pill every 6 hours and you're taking 2 pills every 6 hours, that could technically, and is technically, misuse. And so the majority of people are misusing prescriptions in that way, but that doesn't necessarily mean that they are addicts or they become addicted to these pain pills. The problem is when people start using them recreationally, then they certainly are at risk for a greater degree of problems.
Okay. And so if that's the case, then the folks that we see who are addicts may look just normal. So it's hard for us to...
Well, that's exactly right. It's interesting. I think a lot of people have this impression that addicts look different, that they look like people around the courthouse or the sort of the edges of society, and that they, kind of slither along in the shadows, when in fact, the average addict in West Virginia looks pretty much like everybody else you'd see out at the grocery store or the mall or wherever. And one of the comments that my students, I'm sure Jim's constantly make, is that the patients they come into contact with are so normal looking. I mean, they're housewives and they're people that work, they're young people, they're students. They look coal miners, they look like everybody else. They're not these people who sort of have a stereotype. A lot of people have a stereotype what an addict might look like. They really look, like the rest of us. And I think that's an important message to get out, because this drug addiction, it is everywhere. It's not just in, unemployed, sort of derelict kind of people. It's everywhere.
Mm-hmm. So if superficially they look normal, how can loved ones identify those who are having a problem?
Sure. Often it is the loved ones who will identify these folks first. And certainly changes in personality and changes in behavior is going to be a telltale sign. Are people spending less time doing the activities that they like to do? Are people spending less time with the people that they like to spend time with? Are they acting bizarre? Are they often sick in ways that has been inconsistent with past behavior or states of being before? Do you find that frequently lying, frequently stealing, money is missing that is unaccounted for, these sort of things?
What I wanted to say was, it occurred to me that we're talking about prescription pain pills, and the audience may not understand exactly what we're talking about when we talk about opioids. And it's probably worth at least mentioning sort of the common opioids so that people can think about this. We're talking about drugs like codeine, hydrocodone, and there's a lot of hydrocodones. There's Vicodin and what's a couple of the others?
Sure.
Loratabs, Loracets. There's oxycodones like Percocets, and now there's Roxicet and OxyContin itself. There's drugs like Demerol and morphine and fentanyl. I mean, there are a lot. There's a new one out that's oxymorphone called Opana. There are lots of opioids, these really powerful pain pills, and that people might call narcotics otherwise. I mean, they're basically opioid pain pills, but the common language sometimes is narcotics, and there are a lot of them out there. They get used for lots of different things. Unfortunately, there are a lot of people that that are on them for chronic medical conditions, for back pain or for headaches. There are a lot of people, as Jim said earlier, who are on them, for maybe some pain issues, but also maybe for just recreational use, and that's a big problem. The one thing about these drugs is that they're very powerful pain pills, but they're also very seductive because they make you feel good. And if and one makes you feel good, 2 or 3 will make you feel really good, which is how people get seduced into using them fairly quickly.
Well, hopefully we'll get into prevention further, but then based on what you're saying, then it's really maybe the first line of prevention is the physician educating their patient about what they're prescribing. Mm-hmm. But then there's also doctor shopping, right?
Yeah, absolutely. One of the things that we often go about and teach other physicians is, number one, train your patient to be a good patient. And that means take the medicine just as prescribed.
Right.
And to also, because we live in a state that this truly is an epidemic, the prescription pain pill misuse, guard your pills and put them in lock boxes. Do not just assume by putting them in your purse or in your medicine cabinet that they will be there when you go look for them again, because there is a market for these pills and you have people that will steal them to use or steal them to sell.
Yeah, we could tell lots of stories, but it's interesting. There are people who will get a prescription for an opioid, and there's folks who will wait outside the pharmacy to buy that prescription from the person that just went in to fill it. I mean, there's a huge market, and it's an expensive market, but a huge market for these drugs. And we were talking before we came in on maybe to bring this home a little clearer. There are a lot of patients. On Wednesday, I saw 45, and Jim said he saw 40 yesterday. There are a lot of patients out there. There's a huge need. There's a huge demand. And in some ways, I've said this for a long time, the 3 hardest words for an addict to say is, I need help. And there are a lot of people out there who need help, who are afraid to come forward, or they're afraid to be stigmatized, or they don't know what to do, or the families don't know what to do. But this is a really important issue.
Okay. Well, we have our first caller. It's Phil from Wood County. Phil, welcome to Doctors on Call. Go ahead with your question.
Well, thank you for what you do. You've already hit on a couple of issues which I've seen happen before, like people waiting for someone to come out with a filled prescription. My first question is, you mentioned doctor shopping, and one, can you define that? And two, I take Sudafed. It seems to be the only thing that really works for my sinuses. Now, I get my Sudafed from a major retailer, and it used to be where I could get 2 boxes, a 48 count, but now they dropped that down to 1. So one is not going to cut it, for a month period. So what would you suggest I do to get more when I need them? Thank you very much, and God bless.
Well, certainly that is an issue for a lot of people, and the regulations for the Sudafed are in place to prevent some of the building blocks to make methamphetamine, which is a huge problem in a lot of areas, and so that's why that is there. For Phil's case, I would recommend that he sees his primary care doctor, and that they look, why are you having these sinus problems? Or are there other medicines that you can get as a prescription that then can treat what is going on in the long term, so he doesn't have to go through this rigmarole of signing something at the pharmacy or every time.
And Raleigh, what about doctor shopping? Can you explain that to our
Well,
audience?
doctor shopping is when you go from one doctor to the other, and oftentimes the doctors don't know about each other, and sometimes you'll go to multiple doctors. And in West Virginia, unfortunately, a lot of people go over state lines. They'll go to Pennsylvania, they'll go to Ohio, they go to Maryland, they go to Kentucky, which then it becomes harder to track doctor shopping. But what they do is, in order to obtain drugs in the quantity that they think they need, they will go to multiple different prescribers, some usually with a similar story, trying to get pills. So they just they shop for doctors.
Okay. Well, we have a question from a viewer who'd like to stay anonymous, and her question is, are there alternatives to methadone clinics? Let me start with, what is a methadone clinic?
Well, a methadone clinic is a clinic where obviously one goes to get methadone. Methadone is a medication that has been around for quite a number of decades as a alternative to using opiate pills or heroin off the streets. And the idea is you're going to a certified place where there are professionals there who are giving you this medication, methadone, to prevent you from going out on the streets and using. So it's supposed to satisfy the cravings that one has and keep people from going through withdrawal. As far as alternatives to methadone, the biggest alternative that we have, and the most important probably breakthrough that we've had as addictionologists over the last decade, maybe even 2 decades, is this medication called Suboxone, which has been a tremendous tool in helping people get better, which is a little bit different than the methadone.
Mm-hmm. And sorry.
I was going to say Suboxone, you have to have a special license to prescribe Suboxone, but one of the benefits is that you can get it in a doctor's office, and a good, reasonable clinic can be organized around this medicine whereby people can get treatment and get better. Methadone clinics are special. The caller was right. I mean, methadone, you have to go to special clinics to get methadone. You don't go to a doctor's office, you go to a special clinic. With Suboxone, one of the benefits is you basically go to a doctor's office and receive treatment.
Okay. Our next caller is Terry from Berkeley County. Terry, welcome to Doctors on Call.
Thank you.
Go ahead with your question.
I take hydrocodone 10-650 every month, and my apartment was broken into, and my medication was taken from me. And I talked to the pharmacist, and he said I cannot get any more medicine until next month. Is there a safe alternative that I can use until then, since the over-the-counter medications aren't as strong?
Well, that's a big problem, because stealing of medication is something that we hear about every single day. And again, this is one of the reasons that if you have opioids, you absolutely need to protect them. Even if you take them absolutely correctly, like I'll assume the caller does, if somebody knows you've got opioids, they might try to get them. The problem is that once they're stolen, they're not going to refill them early. And it does leave this lady rather vulnerable. I mean, she won't, her choices are relatively limited because she's right. Once you're on opioids, if she's going to take other medications, they're not going to be quite as effective. And unfortunately, if she suddenly stops her opioids, she might have withdrawal. There's a real defined syndrome that occurs when people suddenly run out of their opioids. They get sick, and oftentimes they have a rebound of their pain, and it's likely to be tough for her. She could certainly talk with her doctor and see what the alternatives are, and maybe they'll be able to help her. But this is a problem when you have it stolen. This is a big problem.
Jim, who's most at risk in the population for becoming addicted to prescription drugs?
Addiction overall in the general population is about 20%. Okay, so 20% of anybody can be at risk for addiction. What we're finding here in our state is younger generation, 18 to 25, folks who are starting using, unfortunately we're hearing people starting using more and more at a younger and younger age. I'm talking playgrounds even. Where marijuana used to be the gateway drug, gateway meaning that you smoke marijuana and then that leads to other harder drugs, that actually prescription pain pills is the new gateway drug. So we have people who are in the state who are starting abusing prescription pain pills even before marijuana, even before alcohol. And so that in my mind are the folks who are most at risk. It's our youth right now.
It's interesting. I just want to echo that because, having done addiction medicine for a long time, and even the audience out there who may be a little older, most people remember when the drug they started with was maybe tobacco or maybe marijuana or maybe alcohol. And nowadays, young people are starting right fresh out when they start into drugs, are starting with pain pills. Oftentimes they're getting from their family. They're finding them right in the medicine cabinets at home, or they're getting them from their friends. But that is one of the most remarkable things that's happened in my career, is to see this sort of taking off of these very powerful prescriptions at such a young age, prescription drugs at such a young age.
Is addiction in the elderly different? Because it sounds like the young is more recreational. Are elderly people more likely to become addicted because of their age?
I don't think they're more likely to become addicted. The young folks tend to learn about drugs from their friends, which leads to all sorts of misinformation and misadventures. Older folks oftentimes are more likely to get them from a doctor, and find out that over time, that if they're taken like they're supposed to, that they're not working, and so they increase their dosage, which gets them into trouble. But we don't see in our clinic, and there are a lot of patients, we don't see a lot of people, we see a few people in their 60s. I don't think we have anybody in their 70s in the clinic. The vast majority of people we see are, late teens to 30s. That's the vast majority of people we're seeing coming in.
Wow. And Jim, is there a genetic preponderance to becoming addicted?
There is. We know that for a fact. A lot of the literature that we know about genetics and addiction comes from folks who have become addicted to alcohol. And we know that if you have a first-degree relative, meaning a father, or a mother, brother, or sister who is addicted, that your chances of having addiction is pretty high as well.
Interesting. Okay, our next caller is Larry from Raleigh County. Larry, welcome to Doctors on Call.
How you doing? Thank you.
Go ahead with your question for our experts.
Okay. Thank you. All right, I'm from Raleigh County. We have a methadone clinic here. Once the people go there, get their methadone, it is the highest accident rate in Raleigh County when they leave there.
Okay, so
Well, I mean, he brings up kind of an interesting point. Methadone, typically what you do is you drive to the clinic every day, you get your medicine, and then you get back in your car and you leave. Sometimes, unfortunately, when you take the methadone, you've also gotten some other stuff from other places. And so what you see, and I know what he's talking about because there are a lot of car accidents that are associated in exactly the way he's saying. But what you usually find out is that the patients are not just taking their methadone, they're also taking tranquilizers that they've gotten from somebody else, or they're taking other opioids in addition. But usually it's a multiple drug problem. And what that does, that leads to sedation, being sleepy and not being able to drive a car correctly on the road. And it's not just Raleigh County. That happens, I could tell you several counties where that's occurred, and it's a problem.
Okay. Good luck to you, Larry. Our next caller is Seal from Maryland. Seal, go ahead with your question.
Yes, my question is, I take methadone from a pain specialist. I have severe spinal arthritis, and I've been listening, and it doesn't make me feel any of those things, drunk, sleepy, high, or anything like that. Is it common to be taking methadone? Because people have reacted that have heard me say I'm taking methadone like I'm getting off of heroin or something, so that's my question. Do I need to be worried at my age of being addicted to it?
Well, how old are you?
61.
Okay.
So obviously that's a good point that Seal makes, is that it's important to differentiate addiction from dependence. Mm-hmm. And so most likely Seal is somebody who has been on a medication that if you take it long enough, your body will become physically dependent on this medication. So if Seal were to stop this medication now, she would go through a predictable withdrawal. She would get sick. That doesn't mean that she's out lying, cheating, stealing, and doing whatever it is that she can do to try to get methadone, okay? So she probably doesn't have the addiction the way some people do. Methadone is also a medication that is not only prescribed for those who are addicted, but it's also prescribed for pain, for folks who have and suffer from chronic pain.
Yeah, actually it's a pretty good pain medicine in that way, but I'm sure that she is stigmatized so much because most people, when they hear the word methadone, they think, oh, this must be a heroin addict or something like that. They're on methadone. But it's a legitimate pain medicine, and it sounds like she's worrying unnecessarily at this point.
Yeah, well, part of it then is education, a show like this.
Part of it's education and a show like this, that's right.
Hopefully we're doing a good job. Can we talk about some of the symptoms that you get when you're withdrawing so that family members, well, I guess in some cases you're going to expect them to have it, and then the family has to deal with them while they're withdrawing. So what are some of those symptoms?
Symptoms of opiate withdrawal are flu-like and leaky symptoms. Mm-hmm. So if your body can leak anywhere, your body will leak when it goes through opiate withdrawal. So if you'll have tears, runny nose, diarrhea,
sweating,
sweats, this sort of thing. Also, flu-like symptoms. People get cold chills. They get goosebumps. And then this really deep bone or even muscle pain. People can have fevers, insomnia. They can't sleep. They get agitated.
Have a hard time sitting still, want to move. Mm-hmm. I mean, it's very much like having a bad case of the flu. Oftentimes the patients will even say, oh, I've got the flu again. I mean, that's what they'll say to us, I got the flu again. And it's pretty clear because it's an opioid withdrawal, but it looks very much like the flu.
How long does it last for? Is it dependent?
Yeah, it depends on how much medicine you've been on and which medicine you've been on. If it's, if it's a drug like heroin or some of the pills we're talking about, it may just be a few days. If it's methadone and you suddenly stop it, you may have it for a couple of weeks. Oof. It can last for a long time. Usually it's kind of intense for a few days with most of these medicines, and it starts getting better.
Okay, well, these folks have you two to go to and other physicians. What about support for the family? Do you guys deal with the family members as well?
Yeah, absolutely. It's a cornerstone of most treatment, because we know that addiction is not isolated just to the person who's an addict, but it's truly a social disease and it's a family disease as well. One of the biggest resources out there to help people who have family members who are addicted is a support group called Al-Anon. And we try to refer all of those people that we work with to Al-Anon. And you could find this group in the paper or on the internet, and they have meetings much like 12-step meetings like AA, Alcoholics Anonymous, or NA, Narcotics Anonymous.
You know, I should also say that oftentimes, I said the patients have a hard time saying, I need help. Usually it's the family going, I need help with him or her. And so an awful lot of people will come into treatment who come because a family member, the wife, the husband, the mother, insists that they come in. So they accompany the patient in. And oftentimes the family story is a whole lot different than the story the patient is going to give you.
Wow. Well, we wish the best of luck to all of our callers and everyone out there who's suffering with this problem. We've been talking about drug abuse with Dr. Raleigh Sullivan and Dr. James Berry. Thank you both for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Join us again next week for Doctors on Call. Our topic will be pregnancy and newborns. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.